There are two types of fentanyl, pharmaceutical fentanyl and illicitly manufactured fentanyl. Both are synthetic opioids, which means they're made in a lab. Pharmaceutical opioid is commonly prescribed for severe pain to treat patients that have cancer. It is 50 times more potent than heroin and 100 times more potent than morphine. Illicitly manufactured fentanyl also comes in different forms, including a powder and liquid. In a powder form, it's commonly mixed with other drugs such as cocaine or heroin to increase its euphoric effects or a high. In a liquid form, it's available as a nasal spray, eye drop, or it's often dropped on a piece of paper or candy. It has many street names such as Jackpot, Apache, Dance Fever, Tango and Cash, Goodfellow and Friends. Yes, anyone who takes fentanyl can become addicted. You can also develop tolerance, which means over time you have to take higher doses to achieve the same pain relief or euphoric effect. That puts you at risk for a fatal overdose. You can also develop physical dependence, which means you'll have symptoms of withdrawal when you stop the medication. Fentanyl is a powerful painkiller. Also at high doses, it creates a euphoria or a high. It is associated with side effects if used incorrectly or for long periods of time, including dry mouth, constipation, nausea and vomiting. You become very sleepy and sometimes even depressed with continued use. It does lower testosterone, so it's also associated with a decrease in sex drive, strength, and energy. Overdose and death are the major dangers associated with the use of fentanyl. The risk of overdose and death increases with higher dosages and with longer use. Overdose is the result of the brain becoming overwhelmed by the drug, which inhibits the body's natural ability to breathe, which can result in brain damage or death. These overdoses really are associated with illegal use of fentanyl. It's because it's mixed with other drugs frequently, such as heroin or cocaine, with or without the user's knowledge, and that's when it becomes particularly dangerous. Recognizing an opioid overdose can be very difficult. If you aren't sure, just assume it is because you can save a life. Signs and symptoms associated with an overdose include small constricted pupils. The individual can be limp and feel cold and clammy. They can be very sleepy, difficult to arouse, or even unconscious. They may be breathing slowly or not be breathing at all. Their skin can also become discolored, either bluish or pale, especially around the lips and nails. Fentanyl and synthetic opioids are the most common cause of drug overdose. In fact, even small doses can be deadly. In the United States, 180 deaths occur every day due to an opioid overdose. Unfortunately, most illegal drugs don't come with an ingredient list. As I mentioned earlier, drugs are often laced with lethal doses of fentanyl. You won't be able to see it, taste it, or smell it. Remember, it's often difficult to tell if someone's overdosing. If you aren't sure, just assume they are. You will save a life. Remember to always get help immediately and never leave someone alone. You should call for security or dial 911. Administer Narcan if it's available. You should attempt to keep the person breathing and awake. You should lay them on their side so they won't choke, and you should stay with them until assistance arrives. Narcan is a life-saving medication. Remember, with a potent opioid such as fentanyl, it may require a second dose. Also, it will never cause harm, so even if you aren't sure what the drug is, administer Narcan. There is a national opioid overdose epidemic. More than 500,000 people have died over the last 20 years, and that number's on the rise. That rise can be characterized by 3 distinct waves. The first wave started in the 1990s due to an increased use of prescription opioids. In 2010, we saw another rise due to heroin overdose. Since 2003, those numbers continue to shockingly rise, and it's associated with the use of synthetic opioids, particularly fentanyl. In fact, that number has risen 18 times since 2013.